A tooth becomes abscessed when bacteria invade the pulp chamber, which is the innermost part of the tooth containing blood vessels, nerves, and connective tissue. This invasion typically occurs due to a deep cavity, giving bacteria an entrance to the pulp. Trauma, such as a sporting accident, a fall, or even extreme biting impact, also can kill the tooth pulp by causing severe damage to the blood vessels and to the nerves within the pulp chamber. When a tooth experiences significant physical injury, such as a fracture or impact, the delicate tissues inside the tooth can be crushed, torn, or even severed. Aggressive dentistry, such as overly aggressive crown preparations, can physically damage the delicate pulp and cause it to die and become necrotic. With an overly aggressive crown prep, the distance from the surface of the prep to the pulp via the dentinal tubules becomes shorter and gives the bacteria an easier journey to the pulp. You can see in this x-ray how much of the tooth was ground away, leaving the pulp vulnerable. That's why conservative dentistry is so important. Once the bacteria reach the pulp, they multiply and cause an infection, leading to inflammation and the formation of pus. Swelling in the confined space of the pulp can press on nerves and cause pain. As the infection worsens, it can spread to the bone, forming an abscess, which is a painful pocket of pus at the root of the tooth. It can enter the bloodstream and cause widespread problems. In the case of physical trauma, the natural defense mechanism of the pulp is compromised, allowing the typical bacteria normally kept at bay to take over, multiply, and become problematic. Without prompt treatment, the infection can spread further, potentially causing severe complications. Our bodies have several mechanisms to fight off infections. Number one is innate immunity. This is the body's first line of defense and includes physical barriers like skin and mucous membranes, as well as chemical barriers like enzymes and acids and body fluids. These barriers prevent pathogens from entering the body and inhibit their growth. The tooth structure itself, enamel and dentin, is a physical barrier. That's why dentistry should be as conservative as possible to protect the integrity of this barrier. When the tooth is traumatized from whatever source, the odontoblast cells in the pulp lay down secondary dentin as a protective barrier. However, that trauma can be at such a degree that it overwhelms this protective response. Number two is the inflammatory response. When tissues are injured or infected, the body releases chemicals that trigger inflammation. This response increases blood flow to the affected area, bringing phagocytes that engulf and destroy pathogens. Inflammation also helps isolate infection and promotes tissue repair. However, in the dental pulp itself, these cells can enter and do their job, but being in a confined space and a small entrance and exit, which is the apical foramen, the circulatory system is at a disadvantage at removing the toxins and infections. Number three is adaptive immunity. This is a specific response tailored to the particular pathogens, and it involves the production of antibodies, which are proteins, that recognize and neutralize specific pathogens. Additionally, specialized white blood cells, called T cells and B cells, directly attack infected cells. Again, the confined space and the small apical foramen keep it from effectively entering the pulp chamber and effectively carrying the infection away. Number four is memory cells. After infection is cleared, the immune system retains memory cells that remember the pathogen. If the same pathogen enters the body again, the immune system can mount a faster and more effective response, often preventing illness altogether. And once again, the anatomy of the pulp chamber and the limited blood flow makes this process less effective with teeth infections. Overall, the immune system is a complex network of cells, tissues, and organs working together to defend the body against infection and maintain overall health. That's why a dental abscess or infection may not have pain. The infection can leave the tooth, exiting the dental foramen, and spread to the surrounding bone. The infection is now encased in bone, which limits the immune system's ability to remove the infection. This can go on for a long time with no symptoms. However, the time may come where one's immune system may become compromised for any number of reasons. The bacteria will multiply, and the dental abscess will overtake that equilibrium balance, become acute, and cause much more serious problems as the infection spreads. The fact that the inspection is confined to the pulp chamber or encased in bone is why holistic treatments or even antibiotics cannot provide lasting benefits as much as we would really like them to, as the entirety of the abscess cannot be accessed and removed entirely with the tooth in place. It is like a splinter embedded under the skin. You can keep symptoms at bay with various treatments, but it will always flare up until the splinter is removed. So with the tooth, the only definitive answer is either a root canal, which itself has controversies, or an extraction. Either approach requires an in-depth discussion with the person and the complete set of circumstances they present with, overall health, autoimmune disorders, position of the tooth, etc., to come up with the appropriate plan for that individual. That is the essence of the holistic whole health approach.